Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Osmotic diuretics. Osmotic diuretics, the main mechanism of action is in the osmotic diuretics, we mainly give the osmotic substance is given either orally or by intravenously. So, this osmotic substance which is given, this will provide the osmotic effect. Actually, this osmotic tissue, osmotic diuretics, we give substances like mannitol or glycerin are given in the or are given orally or IV. Mainly they are given intravenously, and once you give these intravenously, these will reach the blood. Okay, in the blood, they will reach the kidney and then the nephron. In the nephron, because they are high osmotic substances, they are filtered into the urine. Now, because now they are filtered into the urine, in the glomerulus they are filtered into the urine. Now they are present in the urine. In the urine, the osmosis in the renal tubules increases because of this osmotic diuretics. So as a result, whenever there is osmotic increase, when the osmolarity of the urine increases, the water always flows from low osmolar region to high osmolar region. So water will get secreted from the blood into the urine, and as a result the excess water is excreted along with the osmotic agents. So this is how the osmotic diuresis works. So the main effects of osmotic diuretics are these will increase the urine flow. These osmotic diuretics will cause increased urine flow. They reduce the brain volume, and these will also decrease the intraocular pressure. They will decrease the intraocular pressure, and thus they can be used in glaucoma. So initially they cause hyponatremia, but later once the fluid is lost from the blood, there will be increased viscosity in the blood. There is increased substances are present in the blood when compared to water. So as a result, later the patient will have hypernatremia. Then, clinical features or uses. They are used in conditions of impending renal failure. You can use them mainly due to increased solute load, especially in rhabdomyolysis and chemotherapy. You can use this. They can be used in conditions of increased intracranial pressure, or for glaucoma, we can use these osmotic diuretics. Toxicity of these osmotic diuretics are they can cause nausea, vomiting is seen, and even headache is seen in the osmotic diuretics.
thank you and thank you for watching.